Life is complex, so is our mental health. It cannot be understood by diagnosis alone. Our philosophy is treat the person, not the mental illness. Hello everyone and welcome to another episode of Humanizing Mental Health. I'm Trent Nickers.
And I'm Jeremy Alcorn.
Today I'm sitting down with two of the favorite people in the office that I'd love to chat with. One of them, of course, you already know, which is Jeremy. And
Hello.
And then the other one here is Lisa.
Hi.
And you joined our crew rather recently. Like, what has it been now? 6 months?
No, it's not quite 4 months.
Oh,
Yeah.
okay. Well, that just
4
shows
months.
how long it feels like you've been here because you've added something so unique to Psynergy.
Yeah.
Thank you.
Yeah.
So this is Lisa Mitchell.
Yeah, Lisa Mitchell. Thank you. I was like, I was going to say Michelle, and so I,
And you're like, "Oh, wait a minute, one of my favorite people. Oh man, and now I'm on air, and I can't. Their name went out of my head."
yeah. Like then all I could think of was like Michelle Tanner.
Yeah, exactly.
Yeah.
Mm-hmm.
So Lisa, like you talk about the fact that you do acupuncture, and I think that's something that maybe a lot of our listeners would be familiar with, because I think it's something that is definitely in the zeitgeist of care and of treatment, but it's really sort of a broad topic, isn't it?
Yeah, it's most people that I talk to in this town, they still aren't really sure how to use Chinese medicine and acupuncture. So it's helping me to sort of narrow that down myself so that I can help my clients.
Yeah, in fact, as you both speak, the thing that jumps out to me is immediately you say acupuncture and a person has at least an idea. They know people that have been to acupuncture. Maybe some people have experienced themselves. But then you say Chinese medicine, and some people wouldn't even necessarily link acupuncture and Chinese medicine together. They wouldn't know, oh, that is from Chinese medicine. It's one methodology. Mm-hmm. There's this bigger umbrella of Chinese medicine in which acupuncture fits, if I understand that right.
Oh yeah, there's, Chinese herbal formulas and gua sha and cupping and lots of, and a registered acupuncturist like you say, that's part of the whole. And it's very different than, say, needling that we do. So That's where some of the confusion comes in as well, because a lot of people have had needling done.
Sure, and some of that maybe comes from a different position. Like, so we frame this episode as, will it work for that? Mm-hmm. And because a lot of people, I think, go in, they see an acupuncturist, they're like, I have a specific pain.
Right.
My right shoulder's not moving right. and so
come,
I want you to,
neck.
I got pain in my neck. I want you to needle me up and get me going again.
Yeah.
But they don't even actually understand necessarily the mechanisms through which actually it works, and that it's not just for some physical pain.
Right. They don't even they might not even understand why all the questions. Why am I asking them about digestion and how's their sleep and all of that? Because everything can obviously be a part of it. It's holistic healing. And then there's just the channel. Why are you actually not sometimes putting needles in my neck if my neck is sore? Right?
Right.
So,
yeah, for sure. In fact, my own experience, Trent, have you had acupuncture?
Oh, I recently had acupuncture by Lisa for a headache, but then I've had acupuncture in the past from my physiotherapist years ago. And you and I ended up talking about that. That's where it was like the difference between like having a physiotherapist to do it versus yourself.
Yeah.
And you explained it in a lot more greater depth than even he did, because we talked about different things like the dragon's crown and stuff like that.
Well, which is pretty cool. So I could never say if you go to a physiotherapist or a chiropractor that you're not receiving acupuncture if they are a registered acupuncturist as well. But if they're not, it's more that you're getting needling done, which is the proper term.
Okay. Right.
So there'll be more, local area, that sort of thing. And it comes from a bit of quite a different perspective. So.
Sure. Yeah. I think you put that together nicely, because when I first went, it was because I wanted pain to be sorted out, physical pain. And then as the first individual that I saw previous to having met you went through stuff, they went, seems to be a problem with the liver. And I was like, I got a liver problem? and then they're like, no. It's your Chinese liver. I was like, wait, I have a Chinese liver? What are you talking about? Is that a liver problem or is it not a liver problem? And then as they started to talk to me, they're like, well, this is an entirely different way of understanding human health. And that word that I use, liver, is also used in a Western context, in Western medicine. We're actually not talking about the same thing. And but that big picture really sitting on me of going, oh, this is a completely different way of knowing.
It is, and it's tricky because people are doing studies and trying to look at how these things are related. Like if the acu points are attached to the meridians and the meridians are attached to the organs and the organ systems, how are we going to look at this? How do we explain this to Westerners? So this is the work that I'm even doing within myself.
Yeah, for sure. Yeah.
So,
and I guess that comes up. I'm wondering what kind of resistance and or questioning you get from people that come into you that come mostly from a Western medical model with this.
I don't necessarily get resistance because they're here, but I would definitely get, let's see what magic can happen here, which I understand, to a degree, because that's sort of what I was thinking as well. And then the more I was doing this and the more that I understand. So you can still do Chinese medicine and go through all the schooling and not exactly fully grasp from a Western point of view why it's working. We're working on that. Is it the fascial planes? How is it connected to the nervous system? All that sort of thing.
Sure.
Right? But I still see that it's working.
Yeah.
I still see that these thousands of year old medicine, and wherever they picked it up from, if it was intuition or where it came from, I still see that certain points have a stronger effect along those channels in a certain way.
Yeah. Like I remember as we were talking about even the possibility of this episode, and you're framing some of that way in which how do I line up with people's current understanding in some way? That's really what it comes down to. And I think, well, maybe it's about them learning something new. Maybe it's not about their current understanding. Maybe their current understanding, if it was going to work, they would have got better.
Yeah.
But maybe it's actually about learning something new. And that's where, when we're talking, I was like, well, isn't it actually about the flow of qi in your body? And that's just something they don't know, or it's not something they have been aware of. Yeah.
And to accept that that's the understanding, that maybe that's all they need. And if they leave and eventually they're feeling better, I think people are open. They're obviously open to it now. They're coming in and they're seeing changes. And so, maybe that's just enough to say, like we have these pathways, and qi or vital energy or whatever you want to call it flows through these channels. And if there's a blockage and you clear it up the way you do with your needles, and I feel better mentally or physically or both, then hey, where do you go from there?
Yeah, sometimes you don't need to know how the sausage is made. Sometimes you just need to know that it tastes good.
Yeah, exactly.
I like it.
Yeah.
Right. But of course the curiosity gets to you, and you want to reach you basically, I'm a Westerner. I want to understand it myself. And the direction I'm moving in, of course, is learning. Is there actual planes? It's not an imaginary line. Is it on the fascial planes? And that's the studies they're doing now. So
is there this overlap in which we can understand from multiple different ways of knowing?
Yeah.
I'm curious, since you've started your journey to where you are now, how has this really impacted how you understand the human body and the way that it works?
That's a very good question. And that answer, you could probably ask me, I might change my answer every 5 seconds. I think it's left me more wide open to trusting more in intuition, because the idea that I used to have was very black and white. So now it's very, you're learning from your clients, you're learning to sort of experiment, feel what's happening for yourself, looking at symptoms, they're getting better, all that sort of thing. So it's kind of a gray and exciting area. It's just
Yeah.
no final, like no black and white answers for me
Mm-hmm.
yet.
Yeah. So as I hear that too, I'm wondering how that almost impacts your own relationship with your body.
Well, it's interesting. I mean, it's sort of, again, it's exciting because when you think that you have these answers and then those answers aren't working for you.
Mm-hmm.
So if I've had mental health issues and I'm not sure how, like, you know, what, say, somebody's prescribed to me is not working, and then I'm sort of opening up this, okay, maybe I don't know now, and let's see what can happen here. You know, maybe I try Chinese medicine and you know, you do these different things. It's sort of left me going, there's more hope now. You know, that's more of a, it's exciting. There's something to tap into instead of going, what do I do now? Where do I go for help? What
Sure.
do I do?
Or maybe some of the types of treatment that the physician can offer are not very appealing. It's like, okay, we're going to do this surgery on your knee. Maybe I would rather have some needles done first.
Exactly. That's another good perspective.
Because maybe I come to a place of wellness.
Yeah.
I don't need to have a knife go into my knee.
Yeah.
I
Or
would
you don't
rather have
want to.
just some needles go in somewhere else.
Yeah.
Maybe in my knee, maybe some other point in my
Yeah.
body.
Yeah.
Mhm.
Yeah. Let's work with the body before we change the body.
Yeah. And I keep saying needles, but once again, that bigger umbrella in which that may be some other processes in which you're guiding someone through, like you talked about, specific medicines.
Herbal formulas, cupping, of course, everybody loves cupping. And, you know, a lot of people are doing it, but I mean, it's so powerful. Sometimes you just get the blood moving again, and it almost seems like a miracle at times what can happen for the body. So everybody gets to go, oh, what is my body capable of? Oh, I didn't know this before. So that's exciting for all of us, my client, myself, everybody. Right?
Yeah, for
So-
sure. So then that question about what does this work for? You know, like, does it work for this? Someone goes, does it work for this? I got experiencing anxiety. Yes, it could work for that. I'm experiencing depression. Yes, it could work for that. I'm experiencing anger that is uncontrollable. Yes, it could work for that. I'm experiencing pain associated with cancer. Yes, it can help with that and maybe promote the ability for you to heal more readily. So there's a lot of different things.
Right. Yeah. That's exactly, I guess when people call me and they want to know, is it going to work for that? I want people to come in and try it out because, again, the medicine is holistic. You're looking at the whole body, what's going on. So you can't always just do that on a phone call. So when I say try it for everything, well, does it work? Well, that's up to the body and the healing and what's going on. But you know, it's quite complex. You want to know
Sure.
what's
Yeah.
involved in
Yeah.
the illness or imbalance.
Yeah, exactly. Because is the problem that my knee hurts, or is the problem that there is an imbalance in the broader sense of who I am as a person, and that my knee is carrying that symptom, and that if I get that balance, then my knee doesn't have to carry that symptom anymore.
Right. And then the channels, right? Where are they attached? You know, what meridian is that pain lying on that, you know, on that knee pain, and where is it attached further on down in the body, right? So,
I'm curious, when people come back for second treatments, how often do you just like sit there, or even after the first, just kind of process with them, like either what that was like or what it was like afterwards? So that,
every single time.
Yeah.
There's always that part because we're dealing with symptoms as well as how they're feeling. So when those change, then the treatments change. You're moving with how the body is healing. So you're coming at it from that place.
Yeah. Interesting. Yeah, because I'm almost imagining too, because I think you've told me a few times where you've almost treated family members, like people of the same family. And I'm wondering if there's a connection between you're seeing symptoms in one family member and how it's almost expressed or will impact the other family member.
Yeah, if I could like piggyback on what Trent just said as he asked that question, like in Chinese medicine, that philosophy, the energy processes, does qi flow not only inside you, but between you and people?
Well, I mean, those are theories that, of course, I would say yes. Did we get taught that exactly? Of course, it's everywhere in the system, like it's everywhere in the world, inside and out of the body. But I would say that acupuncture is treating the imbalances within. Of course, there's lots of energy medicines, but
Sure.
Like as soon as I think of, as soon as you say that, and as soon as you bring that up, I can't help but think of Daniel Siegel's interpersonal neurobiology.
Yeah, that's why I'm wondering, is because that frame of reference then brought me to go, wait, is this applicable to this other frame of reference? Is there someone else in the world that has seen this truth and they've identified it and they use different words to describe it? Yeah.
I guess the only thing I would know, again, it's not part of what we exactly learn, but of course we keep learning as we go, is that ways of thinking, conditioning, of course, are going to affect family members. So, you know, if a mother, you know, like if a mother has a particular issue or some sort of self-esteem thing or is victimized in some way, and she sees the world a certain way and her daughter is listening to her every day and sort of picks up similar behaviors, that can create, again, that sort of blockage right, in the system. So that's kind of
so
how I
you
look
would
at it.
see the chi block inside the person. The environment may have then caused that chi block in multiple different ways.
Yeah.
Could be that they fell and whacked their leg and got hurt. It could be that someone did or said something to them that deeply hurt them.
And it matters, but it doesn't really matter because the imbalance is there.
Right.
So you're going to those different channels to find where the imbalance is and get that flow moving again.
Right.
And then the body, in a sense, takes care of itself.
Yeah, so it's like the person gets to tell the story. In the end, what the story represented to you was a map of where the chi is blocked.
Yeah. And their body can be the story. You know, the channels. And the more in tune you are, of course, as a practitioner, you know, there's many that do Qigong and Reiki and lots of different things. So they'll actually feel, they can actually, you don't need to be good at this, but you can feel sort of where the channels are blocked. So there's a lot to this.
Yeah. So when you work with people, I'm curious, because you're working with all of these blockages, how does that impact your own resonance and in your own body?
That is probably a person, like for every person it'd be different, but you definitely have to, this is where I think things like, and we're not really talking about this today, but practices like Qigong or, you know, maybe you meditate or you take good care of yourself is important because, you know, you're relating to people and if you don't know how to relate and stay protected, I guess, then for sure I used to feel the pains that the person had and I was like, oh, could change that.
It's just that you can't reach all the places on your body to poke yourself with needles.
I wish I could, yeah.
So do you then get someone else to get you stuck?
Get
you unstuck?
I haven't done that recently and I have done my own, but this is where I'm getting more involved in Qigong because it's sort of like being my own acupuncturist.
I see.
Yeah, and I would love, and I'm actually learning to, taking a class right now to teach others to do this. So my biggest goal for me personally is to empower my clients. So the more they can do at home, the better it is. That's what I want. I want everybody to be able to eventually take good care of themselves and then come to me when you're feeling good. Of course, come to me when you're sick and then we can work on these things, but that's the big word for me is empower my clients.
Yeah. So come to me when you're feeling good is about just like getting an oil change in your car. There's nothing wrong. You just want maintenance.
Absolutely.
You took the word right out of my mouth.
It's powerful.
Yeah.
Yeah, my clients that do that come regularly, even when they're feeling good, if they have little symptoms or they've had hay fever or different things in the past, everything just sort of settles down for them, you know.
Interesting. I'm curious, with medicine itself, what are some of the most common things that you're finding that you're treating? Headaches.
Sciatica is a big one. And then I think for everybody, it's anxiety and depression, which for me is kind of my favorite place to go.
What do you find about that is your favorite place to go?
I think it's just because I relate to it in my past. That's what I've gone through. So, of course, I want to help people with their physical pain. And I'd say 90% of people come in for that reason. But the emotional part of this is just, it feels personal to me. And I just love it. I love seeing people feel better mentally, emotionally, and physically, of course.
Awesome. Awesome. Yeah. Well, because I think that you're almost articulating a lot of the same things that Jeremy and I, because I think we want to see people get better. We want to see them, grow and change and be able to function better.
Yeah, absolutely.
Yeah.
And just to know that don't expect you to stay in that exact space of contentment your whole life. So you need to come back, then come back.
Yeah. Mental health is not the absence of illness; it's the continuation of wellness.
Oh, I like that. Yeah.
Yeah. That's a quote I've been using for a while. I just can't remember where it's from.
It's from Trent and Acres.
No.
That's where I heard it.
Yeah. Okay. Provisor, note. I did not originate this.
It came from somewhere.
Yes, it came from somewhere.
Yeah.
Yes.
So I'm also then wondering, and that is what got you into Chinese medicine?
Yeah, that a lot of my clients ask me that, and I don't have the best answer for that. It's just I was doing physical work, I was landscaping, loved it. And then I was getting tired, restless, bored, and I started to see that all my little coworkers that I was working with, I was trying to help them, and I noticed I was in that place of trying to help them physically and mentally and emotionally. And I needed a challenge. And so I was trying a lot of different things. And I started seeing an acupuncturist for my own mental health issues at that time. And he sort of just told me, he said, you need to be doing this. I don't know what he was basing that on. And I went back and landscaped for a bit longer. And then I came to this, and it was complex and crazy. And I love it because I'll never stop learning. So.
As you bring that up, it's so crazy because I think that Jeremy and I, you've even had stories where you've helped other people get into being social workers, being counselors, because they've come to you or you've had conversations with them and you've said, you need to be doing this work. I almost think that it's a common thread for helpers that we seek out other people, and that's how we get into these roles.
Sure. The number of people that have answered in a similar way said, well, this particular thing happened in my life. And then as I worked through it, then I just had this need to be able to help others.
That was a big part for me too. I felt so grateful for all the people that were helping me during that time. And then, of course, mixing that with where my curiosities were. Yeah. So, of course, counseling, of course, was an interest as well. But I think there's something a little bit more, slightly more physical about me as well. So I don't know what the full, and because it's never ending, you can never fully grasp it. I think I like something about that. It's complex.
It sounds like it's almost like ethereal, and you're just it's like trying to look at a Rubik's Cube from 5 different angles.
Well, the fascinating thing to me is the different directions or angles through which people come to that place of getting healing. That is, as you describe this and you describe your own healing process, and I went, I can only imagine. I can't say for sure, but this would be my best guess. You go into the acupuncturist, they work and get your chi flowing properly. You feel this internal strength, and it means you start engaging in the struggles in life in a new and different way. And because then I start engaging in this new and different way, then things start turning out differently for me. And it means that I heal. And from the talk therapy position, it would be the other way around. I build insight into my problem, and then I start doing things differently because I have this new insight. And because I start doing things differently, the energy changes inside me, and I feel better. And so it's at least that's how I would see this. It's fascinating to me because it means that people need to know themselves. Is this, like you said, I am a rather kinesthetic or physical person. That means that this is my route or my path. that I can help and that I can be helped.
Right. And I used all, like you were mentioning, I used all the different sort of modalities to help me. So the talk therapy and the EMDR, and then even, nutrition and all of that. But I did it from sort of one perspective first and then looked backwards and then tried other things. So my idea and why I think I'm drawn to Psynergy, a center like this, is that if you can get clients and they're helping to clear sort of the issues and problems stuck in the body, and they have that awareness and understanding. So they're
Best
talking
of both worlds.
Yeah. And then there's, basic things. Like I don't want to really throw this in, but if I could have had the supplementation, and so where I was sort of in some sort of adrenal fatigue or kidney yang or qi deficiency, as they call it, during that time, and even had the nutrients and minerals during that time, right? And maybe even hormone balancing, looking at these things.
Sure.
So this whole thing to me is in my experience is very important.
Yeah.
It's not just me. It's not just Chinese medicine.
Yeah. The whole reason why you're part of Psynergy.
Yeah.
Because it means that the whole is greater than the sum of its parts.
Yes, exactly.
Yeah, we're all a symphony that works together. I mean, sure, you'd love the sound of a violin, but when you bring everything together, that's when you get the full scope of everything.
Yeah. And that is how I feel very strongly about that. So I've been wanting this sort of clinic idea for a while. So I'm very excited.
Yeah, that is awesome.
Yeah. So I'm trying to think. If you had like one message for like somebody that was thinking about engaging in acupuncture or Chinese medicine and like wasn't quite sure, what would you tell them right now?
Well, I would tell them to come in, and I am very good at working with people's fears. So a lot of people seem to be afraid of needles. So I like people to feel like they're safe there, but that they have some control. So if we end up putting in one needle and they don't like it and they have to leave, then we'll just call it good, and to support them in just feeling relaxed and safe. Because I want that first initial hurdle to be able to be, jumped over. So that's what I'd say. And come, be curious and see what it can show you or teach you or help you with. That's what I would say.
Absolutely. I love that, Lisa. And I really appreciate you sharing that, because I think for a lot of people, whenever they're engaging, whether it be in talk therapy or something else, they feel like, when they go into it, and I've had that discussion with clients before, if you don't want to be here, you don't have to be here. It's just getting through the door sometimes can be the biggest step.
Yep. Especially when needles are involved for some reason. They're tiny little pins, but
They are.
they got to come in and see them, and try it out. And then they get to be introduced to the magic of Chinese medicine and acupuncture. So.
I'm curious, are you good at darts?
Maybe I should try.
Yeah.
Maybe I'd be a natural.
Yeah, because I'm honestly, I want to find a pub with a dartboard to see how
Let's
good
do it.
you. But,
I'll go.
I don't. Maybe I can make some money off of you.
Yeah.
Brought a ringer.
Yeah.
And she didn't even know it.
Yeah, exactly. I'm used to dealing with smaller ones. Hawkeye.
Exactly.
Yeah. Cool.
Right on.
Yeah.
Awesome. What have you really taken away from today, Jer?
Well, even being able to hear this conversation kind of reorganizes things in my mind a little bit, where I kind of just deepens that understanding that there are multiple ways of knowing in our world, and Chinese medicine has existed for thousands of years. And we're wearing like these glasses that we don't even know that we're wearing, that are this Western lens. And so being able to just try to understand that a little bit more was really powerful to me.
Yeah, engaging in the rediscovering. Yeah, cool. I'm trying to think. I think I talked about what I already knew.
Yeah. So probably time to wrap things up.
Probably. I'm terrible at endings. Yeah. What a way to put a point on it.
Well, that's all, folks.
A point on it.
A point.
Yeah. All right. Well, on that note and on that point, I'm Trent Nickers.
And I'm Jeremy Alcorn.
See you next time.
Thank you for joining us today. We hope that this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health.